Bones of hand. The human hand is composed of multiple bones, organized into three main groups: the carpals, metacarpals, and phalanges. Carpals. These are the 8 small bones that form the wrist. They are arranged in 2 rows, proximal and distal. The proximal row consists of the scaphoid, lunate, triquetrum, and pisiform bones, while the distal row consists of the trapezium, trapezoid, capitate, and hamate bones. Metacarpals. There are 5 metacarpal bones, numbered from 1 to 5, starting from the thumb side, lateral, to the little finger side, medial. These bones form the palm of the hand and connect the carpals to the phalanges. Phalanges. Each finger, except the thumb, has 3 phalanges: proximal, middle, and distal. The thumb has 2 phalanges, proximal and distal. The fingers are numbered 1 to 5, with the thumb being number 1. Muscles of the hand. The hand is a complex structure composed of muscles, tendons, ligaments, and nerves, all working together to facilitate movement, dexterity, and sensation. The muscles of the hand are primarily responsible for controlling movement and providing strength, while the nerves supply both motor and sensory functions. Thenar muscles. Abductor pollicis brevis abducts the thumb. Flexor pollicis brevis flexes the thumb. Opponens pollicis opposes the thumb towards the other fingers. Hypothenar muscles. Abductor digiti minimi abducts the little finger. Flexor digiti minimi brevis flexes the little finger. Opponens digiti minimi opposes the little finger towards the thumb. Lumbrical muscles. These are 4 small muscles that originate from the tendons of the flexor digitorum profundus. They help flex the metacarpophalangeal joints and extend the interphalangeal joints. Interosseous muscles. Dorsal interossei abduct the fingers, spread them apart. Palmar interossei adduct the fingers, bring them together. Extrinsic muscles. Flexor digitorum superficialis and profundus flex the fingers. Extensor digitorum extends the fingers. Flexor pollicis longus flexes the thumb. Extensor pollicis longus and brevis extend the thumb. Nerve supply of the hand. Median nerve supplies most of the muscles in the anterior compartment of the forearm and innervates the thenar muscles, except adductor pollicis and the first 2 lumbricals. It also provides sensory innervation to the palmar aspect of the thumb, index finger, middle finger, and half of the ring finger. Ulnar nerve innervates the hypothenar muscles, the 3rd and 4th lumbricals, and the intrinsic muscles of the hand not supplied by the median nerve. It also provides sensory innervation to the palmar and dorsal aspects of the little finger and half of the ring finger. Radial nerve supplies the posterior compartment of the arm and forearm. It also innervates the extensor muscles of the forearm and hand, including the extensor digitorum, extensor indicis, extensor pollicis longus, and brevis. It provides sensory innervation to the dorsal aspect of the hand and thumb.